Hello everybody, today at Suggest Care I welcome you all for the November edition of Health Talk. Today I have Dr. Vikram with me. He's going to talk about gum in healthy and disease state. So Dr. Vikram, hi. So I want to know what is a gum disease, like what is a healthy gum and what is a diseased gum. Can you just explain us about that?
Okay. So first of all, as we know, any tissues in our body, they can be either healthy or they can be in an infected state. So coming to our specific topic for today, that is gum in health and disease. So as we know, any healthy tissues, when it is free of infection, it will be in normal color. Okay, so that is how the color is the first thing which we notice whenever any infections are happening. Okay, so first thing what anyone, either a doctor or a patient, what they can make out, something underlying or some issues are happening with any tissues is the change in the color. Okay, so first is the change, what you observe is a turning of a pink, pale pink, what we call it in our term. So this transition of this pink color towards a more bright red or a reddish pink color in nature, that is when we can note that there is some underlying destruction in the gums which has started. So that is how a shift from health towards the disease has been initiated.
I'd like to know, Dr. Vikram, if you said like the normal color of our gingiva is pale pink, and when it turns to a reddish color, it is a very good sign of gingivitis. So I would like to know, like, what are the risk factors which are associated with gingivitis?
Exactly, like how in any other cases or in any other infections in our body, there is always associated risk factor. Coming to our gum infections also, and specifically gingivitis, there are always some risk factors. And what is a risk factor? It is nothing but any agent or any repetitive habit or behavior by any individual, on a regular basis, making him more prone for any disease. Okay, so that is called as a risk factor, which will make him more prone for to get that disease. So risk factor pertaining to gingivitis are basically our oral hygiene habits. So that is the main base of any oral infection.
Yes.
Okay, so first is always the deposit is the culprit, followed by our personal habits such as smoking, drinking, any substance abuse, or tobacco chewing, which is very much common in our places. So these are all the risk factors which will increase the incidence of any infection, the gum infection in any individual. Okay, so that is where the chances and incidences of getting the gum infections will be at a very higher rate.
Okay, so you are telling like risk factors, like basically in our society what we are seeing nowadays, smoking and using of alcohol and smoke in any form is the major cause which are leading to gingivitis. So there are so many other factors which also lead to periodontitis, which is also type of a gum disease, a severe gum disease. How do we differentiate them with gingivitis?
Okay, so as we're like going according to the topic, that is gingivitis. Gingivitis is nothing but a mild form of gum disease. So in mild form of gum disease, as I told, when it comes to the mild category, so that means if you treat them on time, the reversal will be pretty good, and even the healthy state is going to stay for a longer time, and the collateral damage is very much lesser. Okay, so if this at the milder stages, if any infection is not taken care of, that is going to go or proceed for the next level of gum and bone diseases, that is called as periodontitis. A simple infection is being converted into an infection which is much more deeper in nature, much more destructive in nature, and obviously it is a severe form and type of gum disease.
Okay, so you are saying if the gum disease is diagnosed at a very early stage, which is gingivitis, it can always be reversed to the normal state of gum rather than to the periodontitis.
Exactly. So the earlier diagnosis is the key important key point here. The earliest it is diagnosed, the earlier and the much faster recovery, the simpler will be the treatments, and outcome of the treatments will also be the best if any infections are diagnosed at a very much earlier stage.
So I would like to know what are the different health conditions which are associated with gingivitis.
Okay, so like we can just categorize the conditions into two, which is physiologic and non-physiologic. Okay, in physiologic we have our normal how aging body would have any alteration. So basically it is a hormonal changes. So whenever we have these hormonal changes, that is first we will have it at the puberty. So then second will be specifically for females, that is during the pregnancy, and then again third would basically for the females itself, that will be menopause. Okay, so by this we get to know that females are more prone for this common gum issue that is called as gingivitis. Okay, so that is the main
factors which
influence or which cause gingivitis more.
Okay.
And in the non-physiologic, what we would like to discuss will be the external or induced type of gingivitis, which can be due to specifically external agents like drugs, what we are taking for our systemic issues. So here the most common drugs which cause gingivitis, these are phenytoin-based drugs, what we call them, which basically used for fits and seizures, the different types of seizures and epilepsy, to be precise. Okay, so all these drugs also have a property of inducing an inflammation by reducing slight amount of your immunity, so that whatever the existing bacteria are there in your mouth, they will turn towards the bad side and cause the gum infection.
So these are the physiological and non-physiological conditions which are associated with gingivitis. Then how does gingivitis cause bad breath? Why people say if you have bad breath you might have some gum disease? What is the reason of that?
Exactly, as bad breath can be because of various reasons, from our altered state in our general health and towards a deposit in our mouth. The simplest reason can be like you have been fasting and you have not had enough of water. That can also cause bad breath. But we have to differentiate why the bad breath is. Is it because of an altered state, or is it because of any infection or any underlying disease? Okay. So the basic gum infections is basically because of deposit. That is what also causes bad breath, because of the infection and the infectious products.
So how do we treat gingivitis? I mean, because you're talking about there are factors also which influence gingivitis. There are so many factors which are patient dependent, which leads to gum issues. So how do the dentists diagnose it? How do we diagnose gingivitis? Why is the reason of gingivitis, and how do we treat them?
Exactly. So now coming to the different types of diagnosis by the patient and by the doctor. For any patient, for any person to know if he is having gingivitis, what he can do is just, as we spoke initially, check for the color changes, make it a routine by brushing. If there is any bleeding in your gums, that is the initial sign of our gum infection. And that is what gingivitis is, the initial signs of gum damage and infections. So as we are talking about how we can diagnose it at the clinical level, as any trained doctor would know how to diagnose a gum infection or any other underlying systemic issues at the clinic. So there will be different signs and symptoms what a patient might present. It varies from simple to simple, from bleeding gums, from the swollen gums, or like the tooth is getting hidden by the growing of the gums, excessive growth of the gums, and also there might be slight amount of mobility also in the teeth at times. So it depends upon the clinical manifestation, how any infection is progressing. Any dentist or a doctor can make out at what degree the infection is spread.
So what are the treatment options available for gingivitis actually?
Okay, so exactly to be spoken about, it's not treatment. It basically falls under the category of management. It's not like we do treat something and leave it.
It's like a management.
Exactly, we require proper recall visits, and we have to exactly know the cause why this infection is happening. So basically we have to start from the age group of the patient, like what category he falls in. Is he the patient somewhere around the pre-pubertal age or the pubertal age, or it's a pregnant lady what is causing her, and also could be a postmenopausal lady, or any person who is taking drugs for fits or any other kind of systemic issues. Okay, so we have to decide and like discuss about the underlying factors which can be a triggering factor for the gingivitis. Then when coming to the treatment part in the management, it starts from our basic cleaning of our teeth, which is the main culprit which is causing our infection. So once this basic level of infection control is done by physically removing the deposits which are contacted at your gum and also at the tooth level. So once this is removed, slowly our gums will start getting into a healthy state.
So that means gum disease do require the intervening of doctors and treating it and explaining patients how to maintain it. But does gum disease can it be like fixed by itself, or can we do something? Is there any home remedy? Like these questions are asked frequently, so I would like you to answer on this.
Exactly. There is at a certain level we can use certain home agents or like basic things to keep. Basically, it falls again to the deposit level. So if we can brush our teeth regularly and keep them at least visibly clean, half the infections are taken care of. Okay. So if at all you think you are having certain mild infections, as I said, color change is the basic thing. You can just give it a try by using salt water rinses to make that area clean, because salt water has the affinity to remove all the bacterial, because it's isotonic solution. It removes, and at a certain level it is slightly bactericidal too. So you can just try it only in the milder form of diseases. So if it is not working for you, that means it's the time you visit a dentist and get it checked.
Yeah, so how would you like to add on the term called flossing? So there is redness. Many people think that there is something stuck in between their tooth, the interdental area. So they think flossing. Do you think like flossing can help to prevent gingivitis too?
Exactly. Flossing is one of the oral hygiene aid what we use for cleaning the inaccessible areas of our teeth and gums. Okay. So when we talk of floss, if used in an improper way, it will be like a double-edged. Okay, so instead of cleaning that area, you are inducing a damage.
Yeah.
You are making it more prone for food accumulation and cause infections. So if you have the time and patience to do flossing, make sure you're standing in front of a mirror and do it in a way prescribed or explained by the doctor. And if you do not know, visit a nearby dentist and get it checked and learn how exactly to use a floss.
So how do we know that like gingivitis is getting better? Like when we check ourselves on the home and we are trying the remedies, as you said, like salt water rinses, proper brushing or flossing if done properly can also lead to the reversal of gum condition. So how do we know that how does the patient know that he is getting back the normal gum status?
Exactly. So as we told, it's just like saying that like how can we at home know that there is a reversal from an infectious state to a healthy state of our gums. Okay, so in this what matters most is the level of infection over there. If it's been a recent infection, then obviously by maintaining it clean and brushing properly and thoroughly in that area, within a span of week to 10 days, we should expect that areas to become nice and pink, how it should be.
Okay, as you said,
so that color is the main indicator which you can know at your personal level to know whether the disease is going to come back or is settled down.
So Dr. Vikram, I would like to know what are the consequences of when you leave gingivitis untreated?
Okay, so the consequences of any untreated disease would be obviously the further damage. So in here, the gingivitis is going to lead into much more severe form of gum disease, which is called as periodontitis.
Yeah, as you spoke earlier, it infects the bone.
Exactly, the jawbone and all the entire supporting structures of our teeth, making the teeth more vulnerable for any kind of physical damage, like if we are normal eating and chewing habits.
So, like, what are the does gingivitis cause tooth sensitivity?
Yeah, as I said earlier, it is the inflammation and infection. When we talk of inflammation, that is swelling up of gums. So when the gums are swelling up, it is literally the ballooning of our gums. During this ballooning phase, the gum slightly detaches from the root surface of our teeth. So when this root surface is devoid or denuded from the covering of our gums, So which is moved by the infectious state, that is when the root part, which is a 100% sensitive part of our tooth, is exposed in our oral cavity or our mouth. Okay. So whenever we take any hot, cold or our regular food,
Sweet,
we have a sharp sensitivity kind of sharp shooting kind of pain, which is sensitivity specifically at the root portion of our teeth.
That you are saying that is near the gum region.
Exactly, at the gum line. Okay, where the gum and our tooth.
So, like, which is the like best toothpaste used for gingivitis, leading to sensitivity, or any toothpaste which would prevent having gingivitis?
As such, there is nothing. It's like basically we require mechanical brushing to remove our basic deposits. What brush identifies or toothpaste what we use, it is for additional effects of polishing and certain fluoride, like certain fluoride application and like generating certain fluoride molecules, so that which makes our teeth more stronger for any deep clean. So specifically talking of infection, mechanical removal of any deposit which will be much more helpful than using any specialized paste for this basic initial level of.
So you're saying proper brushing technique and proper toothpaste which would be having some ppm of fluoride in it in a controlled manner should help to avoid sensitivity also.
Exactly. So once the deposit is removed, automatically your gum is going to come and attach back to our exposed root surface.
Okay. So like there's a very commonly asked question that like peroxides help in resolving gingivitis.
Like when we talk of peroxide, hydrogen peroxide, it is nothing but an oxygenating agent. So it gives out something called as nascent oxygen. So they basically work on the principle of causing effervescence, like how you put soda in a glass and you see a lot of bubbles coming up from the surface. So that bursting of the bubble detaches the deposit on the tooth surface. Okay, so basically any oxygenating or oxygen providing agent up to a certain level can take care of infection.
So does it, I mean, because we're using directly on the tooth, and does it harm your gums, the normal gums which are there present beneath the infected region of your gum?
You're not supposed to use it exactly how it is being sold in the market. So you have to, it's better to get it checked from a dentist. Then if it is required, the dentist will be the better judge to tell you what dilution you'll have to use it depending upon the severity of infection. We have to know whether we need a peroxide or oxygenating agent or not.
So Dr. Vikram, can you tell me like what are the age groups or what are the categories of people who can have gum diseases?
Yeah, age is also one of the risk factor, I would say, because after adolescence, as I said, pubertal related changes also can occur in gum. So that is the stage you have to interrupt or intervene in an infectious state. So here, puberty onwards, our hectic lifestyle or lifestyle related changes start. We go to college, again there is stress, we start working, there is stress, and again the 30 to 40th years of our life, that is the worst decade when our immunity is very much on the lower side and stress is at its peak because of all the settlements and everything we have to take care of. So the age group will automatically fall into like the age group of 14 to 15 till 40 to 45 years is the age group which are more prone and susceptible for gum diseases.
So like what are the early signs like they should, like as you told us, the early sign is the gums would become reddish in color, or there will be some swelling, or the tooth would be mobile. But there are is like every mobility of the tooth related to gum diseases, or it could be the sign of or a symptom of any other disease too?
So when we are talking about mobility of our tooth, that means the tooth is not having enough support. So that means the jaw, which is the jaw bone which is holding the tooth, is reducing, and the reduction of the bone levels happen only because of some overlying infections over there. So automatically it will drive us to the same point that there was at a certain level, gingivitis wasn't treated, and then it is it is led to the progressive and the severe form of gum disease, causing bone destruction.
So, can they fix that loose tooth again? Like, if the tooth is loose, so if we, as you mentioned, like if we properly clean our tooth by brushing or go to a dentist and get our teeth clean, and on the maintenance phase, can that loose teeth become firm again, strong again?
Yeah, see, when we do during the diagnosis, we grade the mobility of the teeth, like up to what extent your teeth are mobile. So we have basically 3 degrees of mobility. So wherein grade 1 is a tooth which is moving slightly, but after treatment it will become a firm. So those are called as grade 1 mobile teeth. So similarly, grade 2 is a moderate one which will heal itself to a certain extent, provided the maintenance is done properly after the treatment. Yes, up to a certain extent it is going to become firm. But there is the last one, the last category, that is the grade 3 mobile teeth. These are hopeless in nature. They are moving back and front and in the sides, and they are also dipping inside the jaw. So that means basically this tooth specifically is not having any kind of bone support from any of the sides. Okay, so these teeth will fall in hopeless category, and those teeth will have to get them.
So is gum disease contagious? I mean, I would like to know, like, can this gum disease spread from one person to another?
As we say, like we have saliva, which is the major transport agent for many of the contagious diseases, starting from our coughing and sneezing itself, from viral fever to gum infections. Yes, this also falls in the contagious category and depends upon again the severity of gum diseases. Mild infections, when we talk of, yes, up to a certain extent, but yes, when we have like a clinically visible gum infections where the severe type of swelling is there and severe bleeding is there, obviously that person is not supposed to exchange the food, because these gum and periodontal bacteria, what we call them, those are the tissue bone bacteria. So
is the spread directly from the food or the straws which people use, or the spoon?
It can be from any structure, or like any material or any food what you are eating. It's just the saliva.
Okay.
Which transfer the bacterial agents to another.
Okay, so you are saying saliva is like the main
transporting medium
for the transfer of bacteria which
exactly.
are causing gingivitis to that person to the another person.
Exactly.
Can you tell me, like, how can we strengthen our gums after, like, does the strengthening of our gums happen after the gum cleaning and everything?
Yeah, to a certain extent, there is nothing that we have to strengthen our gums. Just basic thing is like remove the deposit on a daily basis, like every 12 hours what we say, and you can also add a habit of just massaging your gums with your index finger. Okay, so that is much more than enough for your gums to strengthen on themselves. Just keep the area clean and the body will take care of itself.
So there are like many patients who come to our clinic stating that they have loose teeth and they're scared that the tooth would fall off, and like how do we categorize those type of patients?
Or any kind of things that patients are scared that teeth might fall.
Yes, correct.
So basically the cleaning, want to see what the deposits have been accumulated in such patients' mouth. It has been happening over the period of years. So there will be slight drifting of the teeth apart. So wherein the deposit will be accumulating more and more. So what patient will think that removing that interdental deposits will weaken or loosen their teeth. Okay, so yes, obviously when so much of deposit are formed, that means there is some severe deep destruction which has happened, making space and room for that much of deposit to accumulate over there. So yes, there is going to be a transient mobility, what we call it. That means for a certain few days, the mobility of the teeth, that means the teeth can be shaky for few days initially after any process of cleaning, and slowly the teeth will become firm as the day progresses.
So you're saying like people who have gum diseases, they might have loose teeth, and after cleaning these loose teeth will become firm if maintained properly, right?
Exactly, that's what I spoke about, the degrees of mobility previously. So the early mobility and like slight mobility, all such teeth will become firm and good enough so that your chewing is back into action.
So like what are the various ways that we can actually stop these gum diseases progressing so severe that it leads to like bleeding of gums or loosening of teeth?
It's again, it will boil down to the same thing that you have to keep, at least from a patient's point of view or at the personal level. What we can discuss is make sure that when you brush your teeth, make sure you are standing in front of mirror and brushing your teeth, so that you are visualizing clearly and you are able to access all the hard to reach areas of our mouth. So if we do that, 99% of our deposits are removed at the same go. So then there won't be anything much left behind to cause infections in the first place.
So if we say, like, if we are cleaning our tooth properly on a daily basis and visiting our dentist, like as you said, every 6 months for the maintenance part, so there are chances that we will, the patient will get the healthier gums, back over a period of time.
Exactly. So when we are following the setup routine of self-maintenance and also visiting the professional every now and then, so we are under the lens. So if any changes are happening, we'll get to know them at the earliest. So any as we've been discussing, any damage which is being focused on at the earlier stages will give us the best clinical outcome.
So the toddlers, kids, they have, they have a lot of, their parents basically have a lot of question that their kids have dark red color in the gums.
Exactly.
Is that like toddlers also have gum diseases?
Like every human being is having gingivitis to a certain extent. Something we call it as subclinical gingivitis and the clinical gingivitis. So as we talk, there is no human being without gingivitis. Only the subclinical level. When it comes to clinical level, we get to know that there is some infection or a bleeding in the gums or something like that is noticeable. So even toddlers, they also can have gum disease because they do not brush their teeth properly or they require assisted brushing. That someone else has to brush their teeth. If the food is not cleaned on time, so by within 12 hours, it can start a gum infection over a period of time.
So many people have black gums. Does that signify they have gum disease, or it's just the color of their gum?
Color, as such, that dark color is basically the pigmentation, and it's the natural color which goes with the outer skin of our body.
You mean to say the melanin pigmentation?
Exactly, that specifically is called as the melanin pigmentation. That can be physiologic, like in nature, naturally you are having that color, or that can also be induced by certain things called as obviously smoking. Because of it, there can be increase in this melanin pigmentation.
So, I would like to know what is the exact treatment plan which we follow for gingivitis and periodontitis, so that the patients they get aware, when they visit to any clinic, they get aware of knowing how they should be treated for gingivitis and how they should be treated for periodontitis. Okay,
so coming to the topic that is gingivitis. The gingivitis basically is again formed it's carried out because of the stuck deposits here and there. So for the milder form of gum infections or gingivitis, a basic round of cleaning, which is called as supragingival scaling in our terms, that would be more than sufficient to take care of the mildest form of gingivitis.
So you mean like just the superficial cleaning of tooth structure which is visible can just take care of gingivitis?
Exactly. So that is just like whatever the deposits are over the gum, above the gum levels. That is what you call it as supragingival. Above the gum cleaning, that should be good enough to take care of the basic infections.
So if a person gets a superficial cleaning done and not the deep cleaning done, so what would that lead to? Is that dangerous?
That is when you visit the nearby dentist, any dentist or a gum specialist, to be specific, can make out whether you will require a deeper round of cleaning or not. If it is not required, that means the infection hasn't reached down to the deeper structures of your gum and bone. A basic round of cleaning will be more than enough.
So, my question is whether if we leave the deposits beneath the gum, is that dangerous?
Exactly, the deposits which are above the gums, those are dangerous, and the more proportionally dangerous are the deposits which are below your gums, because below the gum levels is it's an invisible area to us, and that's why it is very difficult to remove it out. Basically, you cannot remove it. So that is the hidden place
where the
bacteria is going to proliferate and multiply and cause more amount of bone destruction.
So if we have to take a takeaway message from our talk about the gum health, what would be? Can you just tell our viewers?
The takeaway message would be simple. Again, it will boil down to the one main thing, that is regular cleaning at regular intervals of time, that too in an efficient and proper manner, which will keep you free of gum infections. And also when you are free of gum infections, it's an indication that you might have your oral and general health free of diseases.
So today with Dr. Bikram's talk, I think so viewers might have solved a lot of their curious questions about gum diseases, and they can also check on their gums now to know whether they have any color change in the gum or they have any swelling in the gum which requires the intervention of a dentist. So I would like all the viewers to just have a thought about their gum health once, because it's a very important thing, because in today's lifestyle when we want a beautiful face and a beautiful smile, gum is the main foundation of everything we have inside our mouth. So a beautiful and healthy gum is a very important thing which we have to have it within us. So I would request every viewer to get it checked by the nearest dentist about their gum health.